Hello, guys. Good evening. Welcome once again to my YouTube channel. My name is Dr. Ken, and yesterday we talked about hemorrhoids, and today we are going to finalize it by discussing about signs and symptoms of hemorrhoids, how to make diagnosis, and finally treatment. Now, we said hemorrhoids are painful swollen veins in the lower portion of the rectum and in the anal opening. Now, let's discuss about the signs and symptoms of these hemorrhoids. Um, Sign number one is bleeding during bowel movement. Bowel movement means when you are passing stool, you'll realize that there's some blood stain in your stool. That is sign number one. Number two is itchiness or irritation around the anal opening, and that's the sign number two. And number three is a discomfort or pain around the anal opening, a discomfort or pain around the anal opening. So those are the main signs and symptoms of hemorrhoids. Now, how do you make diagnosis of hemorrhoids? When a patient comes to you as a healthcare provider and complains of the symptoms that we have discussed about, and I know your impression will be maybe cancer of the colon, or maybe your first impression will be even the hemorrhoids. Now it is time to confirm so that you can support your diagnosis. So making diagnosis actually include the examination. So examination is the first thing. Now, when you do your digital rectal examination by inserting your finger into the anal anal uh, anal region, and if a patient is having internal hemorrhoids, actually will feel there are some masses inside, or if a patient is having uh, external hemorrhoids, through visual examination, something that you can see, because external hemorrhoids are hanging outside. So it's something that you can see. So the diagnosis is visual examination, and by doing a digital rectal examination, then you can still do the imaging like anoscope, just to confirm that. Now, when it comes to treatment is there is the main one, management for this, and this is actually this is surgical intervention by doing what we call hemorrhoidectomy. Hemorrhoidectomy actually means removing the hemorrhoids, and the other management include pain management by using the NSAIDs. NSAIDs are strong; those are strong painkillers actually, which can relieve someone from the painful hemorrhoids. Number three is by use of antibiotics. Remember, we said one of the causes of the hemorrhoids was one was the anal infection. So if you actually do your examination and realize there is infection, you use the antibiotics. Number three is by increasing your oral fluid or taking enough water so that can make your stool soft. Remember, we said that one of the causes of the hemorrhoids is constipation. So the only way to approach constipation thing is by taking enough water. So that is increasing oral fluid. Um, Number three is we've talked about antibiotics, increasing oral fluid intake, and taking food or diet which are rich in fiber. So those are the points actually, or those are the things that can help you manage hemorrhoids. But the main management is surgical intervention, that is hemorrhoidectomy. So that is the end of our discussion today. Keep posted.